welcome back from that quick break. So next, I'm very pleased to turn things over to Dr. Shariki Kumanyika, who will introduce our next keynote presenter. Dr. Kumanyika is Professor Emerita of Epidemiology at the University of Pennsylvania and was also a co-chair on the planning committee for the Opus workshop series. Shariki, I'll let you take it from here.
Okay, thank you. Can you hear me okay? Great. So it's really my extreme pleasure to introduce Dr. Amy Carroll-Scott. She's an associate professor and chair of the Department of Community Health and Prevention at the Drexel University Dornsife School of Public Health. Her research focuses on understanding and addressing urban health inequities and underlying social inequities consisting of social epidemiologic and mixed methods. Studies apply to the lived experience of urban neighborhoods and schools. Dr. Carroll-Scott co-leads the Maternal and Child Health Program at Drexel School of Public Health, the Cross-Institutional Philadelphia Maternal and Child Health Collaborative, and the Drexel Community Engaged Research Working Group. And also relevant here, you've heard about the COMPASS program, especially in Opus 1. And Dr. Carroll-Scott is the co-lead for the COMPASS Coordinating Center, which is based at Drexel. And she'll make some comments about that in her presentation. So without further ado, I'll turn this over to you, Amy.
Thank you so much, Shariki. And it's a pleasure to be here with all of you. Thank you so much for including me in this wonderful workshop. If we can move to the first slide. So I have no disclosures to report except to say that my opinions are my own and to acknowledge the funders from the U.S. Department of Education and the NIH who I will be discussing projects about today. Next slide. So I like to think about PSE interventions as complex community initiatives, and that's because I've been moving my work further and further upstream in the last couple of decades, and so have flitted in and out of different literatures. And as we talk about how to evaluate such initiatives, it's important to know what literatures we can pull from because as Erin mentioned so well earlier, it is still a nascent and growing literature for what structural change drivers and targets and process and outcome measures are important. So we need to get to zero in on the literatures that can be helpful to us in this work. Next slide. So what are complex community initiatives? Well, they're an attempt to address health inequities by addressing structural root causes, so moving more upstream. This means designing interventions that are, of course, as we all know, not traditional public health programs. This means including often PSE elements that we've been talking about throughout. They're often multi-level, so they're occurring at multiple levels at the same time, which creates challenges for evaluation. They're often cross-system or cross-sector, as we heard so well over the last little bit of today, how important it is to work with community and community-driven and with many different partners who are decision makers or champions within the sector or systems that they are a part of. And that influence and change is attempting to occur. They often address structural factors, so you can sometimes see them framed as structural interventions, and they often address a defined geography, so you can often hear them referred to as place-based initiatives. Next slide, please. So I'm going to talk a lot today about what we learned from our West Philly Promise neighborhood, but I want to let you know that we've pulled from the very nascent literature on how to do this. And we really love this Kelly article about 5 simple rules for evaluating complex community initiatives. One is that they're not experiments, but part of a very large and very long standing and longitudinal community change process. So understanding your slice of it is important. They need a strong focus on the processes of community change and not just the outcomes. They need to measure this ongoing progress and then to share results in order to guide community change and hold the processes accountable. And that includes community engagement, as you can imagine. They need to understand, document, and explain the multiple theories of change at work over time. And this is where a systems approach is really important. And they need to prioritize real-time learning and communities' capacity to understand and use data from evaluations. And that includes a community capacity building approach as well. Next slide, please. So simply put, this is not your traditional program evaluation. Next slide, please. So I'm going to talk about the West Philly Promise neighborhood. Next slide. So this was meant to be a 5-year grant, which was extended through no cost extensions due to the occurrence of the pandemic in the middle of it, and I will talk about that. It was a U.S. Department of Education funded $30 million grant and was meant to support cradle to career opportunities for kids who 0 to 18 who are either living in a defined geographic area of West Philadelphia or attending school in one of the 7 schools covered in this grant. The idea was to focus on systems building to link and leverage existing effective evidence-based programs to build a systems of support for kids and families in West Philadelphia. So it was not intended to build standalone programs, but to knit them together. Next slide, please. So our cohort is this very defined footprint in West Philadelphia, which is also coterminous with the HUD designated Promise Zone in West Philadelphia. And it is a neighborhood that consists of the 7 schools of our focus, as well as 6 neighborhoods and parts of 4 other neighborhoods. They're traditionally African-American and Black communities that have been shaped by systemic racism, redlining, and systemic disinvestment for generations. Just to give a little bit of context, it is also an area that is surrounded by eds and meds, the University of Pennsylvania, Drexel, and others, and has been overburdened with research and very mistrustful of research for a very long time. Our cohort were those kids who live in this footprint or attend one of the 7 schools. Just to show how complex this is, kids in this footprint attend over 200 schools in the rest of the city of Philadelphia, and kids in these 7 schools live in every neighborhood in Philadelphia. Next slide. So the grant goals were quite ambitious, and this is, typical of a whole of community approach. If you can advance, just to show that there is, just click once. Perhaps the animation isn't working, but you see the 4th goal there is where we as a school of public health got to put our health outcomes and our desire to understand the context and the outcomes of health and well-being for kids and families in this footprint. But it's very holistic an approach to support kids and their families. Next slide, please. Oh, there we go. Next slide. So just to point out that this is a collective impact model, there were many partners that were involved at many different levels, and some of them so grassroots that they do not have logos to put on here. I could spend the entire 20 minutes talking about how this group came together and how they put the proposal together, but just to say that this builds on the kinds of best practices that you've heard earlier today in terms of community engagement and co-creation, and experience a lot of the same challenges and complexities that were also shared. And we were at the center of trying to create authentic community engagement while managing a large federal grant. Next slide, please. So just to be clear, my role as co-PI of the initiative, which was located at Drexel as the backbone agency, and also leading with my colleagues and our very large team, the evaluation components of it. This evaluation design slide implies a simplicity that is just simply not true of our evaluation design, but wanted to sort of boil the methodological highlights for you today so we could get into all of the important lessons learned. But just know that this was building from lessons learned from evaluating the Community Interventions for Health initiative in New Haven, which I was a part of, which was also informed by Shape Up Somerville. Lots of similar initiatives that we found in the initiatives, so that we found in the literature, so that we could build on what was known at that point in the literature. We linked together small data as best as possible through our program tracking system with big data in terms of all of the indicators that we were able to aggregate at the school and at the neighborhood level, so that we could try to understand what was happening at multiple levels of intervention, as well as to prove our population level outcomes that were required by the grant. Next slide. And these are the outcomes. So Promise neighborhoods were required to collect 15 identical indicators, outcome indicators. As you can see, they're a little skewed on the side of education, but if you could advance once. just to show you where our obesity prevention, chronic disease prevention indicators lived. And we were able to, of course, collect other data to be able to provide more context and more process and more outcomes for our initiative. But this is what all Promise Neighborhoods funded in our cohort were required to collect. Next slide, please. So I will give you a very brief tour of our study design. We did have access to the annual climate surveys conducted by the School District of Philadelphia, on which we were able to include some of our indicators required through the grant. And these are collected of students, teachers, and parents. They typically have very low response rates, specifically amongst parents and caregivers. And so we were able to hire and leverage our trained community workforce, you can see on the right-hand side there, to be able to go to school events and improve, explain the reasons for the survey and improve response rates in our 7 schools. We're also quite proud of our biennial neighborhood survey, where we did a randomized sample of households with children 0 to 18 and collected the data throughout the initiative with input and co-creation of both the study design and the items and measures collected in the survey with our community advisory council and with our community research workforce. And then lastly, we did an organizational network survey where we tried to understand connections between all of the partners you saw in a previous slide. And I'll give you a little bit more detail on that. Next slide, please. So I think folks understand school and neighborhood surveys, and I was really pleased to see Erin talk about the importance of social network analysis. So just wanted to give a little bit more context that we're trying to understand both planning networks, advisory networks, but also referral networks, care coordination networks, data sharing networks between all of the members of Promise Neighborhood. And we collected them in categories to try to understand how different actors and different categories of actors were working together to create what we knew would need to be a very cohesive system of supports for kids and families. Next slide. We also were required to create a child-level longitudinal integrated data system. I will just say that in this slide entails what we had intended to do, but moving systems toward a system of supports also means moving systems toward data sharing. And so we were not able to completely establish this integrated data system in the ways that we were hoping. So one of our lessons learned, we did conduct a demonstration project to demonstrate our ability to match data, to keep it confidential, to adhere to all the data security requirements. But if you go to the next slide, you'll see the kinds of data that we were successfully able to link. School records with city service provision records, and Promise Neighborhood program participation records at the child level. We were also able to bring in aggregate school contextual data and neighborhood data to be able to take a look at this holistically. We were not, however, able to get our partners to provide the data longitudinally over time to use it for evaluative purposes. Next slide. We also created the Promise Information Portal, like an EHR, but for programs that are being offered outside of a healthcare delivery system, to be able to provide consent procedures and goal setting or case management and outcome tracking at the program level. About half of our smaller partners provided who have had contracts through Promise Neighborhood did successfully adopt this, and then others who didn't have the data capacity or the technological capacity provided us with the data that we uploaded for them. Next slide, please. And then lastly, just to let you know that we built CVPR as much as we could into this process. And so we presented data regularly. We created community briefs that we included our community researchers in the co-development of. We created user-friendly data dashboards, and we democratized access to the data through a community-friendly code book and also a data request process. So just to show you what these look like, next slide. This is some of our data briefs. Those who participated in the survey got the data reported back to them, and we also disseminate it in the community. And on the bottom there are some of our community indicator thematic briefs that we provided on a regular basis. Next slide. We're really proud of our data dashboard infrastructure, which is co-created with our community research workforce. And next slide, just to show you a boring snapshot of what it looks like to request data from the West Philly Promise neighborhood. So let's cut to the chase. Next slide. What did we find? Well, we found in our schools some limited impacts of West Philly Promise neighborhood on some specific outcomes in specific schools. We found positive improvements in attendance and math scores, in school climate in general, in fruit and vegetable consumption, which would be very salient to this group, and internet access. In the community, we found increases in internet access, and that's due to a lot of the digital navigator work that some of our same community research workforce was a part of. And no change in food insecurity, despite the fact that we would have expected an increase in food insecurity due to the COVID pandemic and the gun violence epidemic, which were co-occurring in Philadelphia and at dramatically higher rates in this community. So as a result, we shifted some of our analyses toward protective effects and found that this part of the city experienced perhaps not as positive outcomes as we were hoping in 2017, but not quite as negative as was expected due to COVID. And then lastly, in the Collective Impact Coalition, our social network analysis demonstrated the growth of connections and the content resource and planning collaborations that we were measuring. Next slide, please. I think it's really important to talk about what we didn't find. I feel like we don't do this enough in our field. And this is a very challenging field of research. So I want to be clear, we did not find evidence of systemic long-term changes in the outcome measures across all schools and neighborhoods. There were little pockets of positive impacts. We lacked sufficient time to observe the accomplishment of true systems level change. And we lacked sufficient time to observe further growth of that network that we were measuring. And so I think it's important to talk about why. Next slide, please. So as was discussed really well, many different stakeholders with different priorities and needs, we attempted to blend these together, but it's challenging work, especially with such a large initiative that was so visible and with so many interests and needs. There were differences in implementation fidelity, dosage, and the different combinations of programs at schools and neighborhoods. In this field, it's very difficult to define who is exposed and what the dosage of that exposure is. As was mentioned in Deborah's talk about how important fidelity is for this. There were major secular effects: COVID, socioeconomic shocks, the gun violence epidemic. There were a lot of illegal evictions happening in this community at the same time. And also it reflects just how difficult it is to change population level school and, at the school and community level to achieve that kind of population level impacts over time, especially during a period of only a few years, despite the copious amount of programming and the attempts to knit them together here. You can't overcome these generations of disinvestment and systemic racism. Next slide. We likely didn't collect enough or the right PSE change measures. This is my #1 lessons learned from today. The challenge of this field is that important systems level outcomes are hard to measure. And if you have good measures of them, it's very difficult to convince very large systems to collect them for you. One of our major data and programmatic partners, not to name names, but had very understandable capacity limitations and honestly a lack of political will for integrated data system, for collecting these kinds of process data, and for integrating our PIP, our programmatic our programmatic platform into their workflow. And so that means that what's happening in those very well-funded components of the interventions is a black box of what's happening. And that's very challenging. Also, there's just simply the challenge of matching complex interventions and this web of interventions to specific population level measures. We have attempted to, draw all of the ways that our data and our children and family and students are connected to each other. It always ends up looking something like the picture in front of you. And it's very difficult to, map the web of interventions to the data that is either already available or able to be collected. Next slide, please. So what do we wish we had? What was our wish list? Well, there were some planning grants in Promise Neighborhood. We did not receive one of them. And the planning and partnership building phase, which I believe Deborah mentioned so well, is so important for this, and Melissa as well. A funding mechanism that's centered on the interests and capacities of community-based programs to do this work. We need to talk about community-led interventions, as was articulated so well before, not just community engaged, where outside change agents are the backbone agencies and receiving the grants. That means building capacity to do that. We should have applied community-based systems dynamics tools from the very beginning. And I know I'm speaking to the choir here. We were able to hire Irene Hedden as a postdoc at the beginning of this and wish that we had incorporated some of her great community-based systems dynamics tools from the very beginning when the proposal was submitted in 2016. We should have conducted social network analysis of partners at multiple time points. We realized how important this was about halfway through. It was not a requirement of the grant, and it should have been built into the fabric of the evaluation. We should have only shared funding with partners who would collect these PSE, most importantly, process and change measures. The common data elements across such initiatives should focus on the process and focus on the systems change, and not as much on the population level outcomes. They are so important, but we already know that they're linked. And what happens in that black box in between funding and intent and population level change is all of the magical stuff that are PSE interventions. Also, a second grant in the same footprint, which is very often not available in Promise Neighborhood, would have allowed us to continue and sustain the work. Next slide. So what are these barriers we can overcome together? I'm just thrilled to add my comments to what has already been said today. We need more of a robust literature on this. We need funding mechanisms that allow for processes and the time needed to partner, to make, and to observe the processes and impact outcomes of PSE changes. We need to be able to observe those changes before the population level outcomes. We need to fix our duplicative deficits-focused data systems that don't talk to each other. We need to understand that even when there is will, and even when there are MOUs, and even when there are contracts, that in and of itself, even champions within systems doesn't necessarily change entrenched systems that, quite honestly, weren't designed to refer or collaborate or coordinate care or share data. And then I just want to point out that community information exchanges and local data intermediaries are excellent resources that should be leveraged for such evaluations. You know, data that is owned by communities, that is available in a publicly available way, and of course, an ethical way, and local data intermediaries who have the ability to look at these community indicators over time that could be easily leveraged for these kinds of population level changes that all such initiatives look to influence over time. And then next slide, please. Last slide. So I'm not here to talk on behalf of Compass. I know you heard from my colleague Allison Brown in Opus One about the importance of this work and how much champions within NIH were really pushing the needle for all of the things that we've been talking about. What's amazing about Compass is that it is community-led, they're upstream structural interventions, and the community-based organizations and their teams are the one identifying the structural change targets and engaging their usual and also new partners to do this work. And there are 25 grantees all over the country. The power sharing and trust building has been a part of this from the very beginning, and they do have a developmental and planning phase with their local advisory groups. We in the coordination center are providing the capacity building all along to support their intervention planning, their evaluation and study design planning, and their implementation. And in that work, we're really trying to focus more on process and PSE change measures. And so as a result, as opposed to 15 required GIPRA indicators, we are working with the grantees on their common data elements. We're making sure that, yes, we are capturing long-term population level changes in social determinants of health and health outcomes, but also we're developing common data elements that have to do with process, on context, on their team dynamics, on their project characteristics, and all of their structural change targets and their process and outcomes of achieving them. The intended longer-term funding period is already revolutionary, given how short funding periods typically are for this kind of work, which has been said so well before me today, and that the explicit goal is to contribute to these important gaps in the literature of health equity research and structural intervention evaluations, and in particular, how they can be best community-led. And with that, I think we are at Q&A. Thank you.
Okay, thank you so much for this. If I can get my face up here, but so we have a room for a couple of questions, and I'm going to start with one and say, sort of full disclosure, that I've had a chance to observe some of this work from a distance, being at Philly. Let me just, okay, I'm gonna guess, there's my video. Okay, and I'm a real fan of this work. Because I've seen how Amy and her colleagues are totally not afraid of complexity, writ large, when it's right next door, and going after it. But I wanted to ask you to comment on another aspect of the work, which is how you have built on the community capacity with helping the the Promised Neighborhood group be able to get grants on their own and stuff like that, and how they feel about this work. And then I have another question that I think we can fit in before it's over.
Okay, great. Yeah, I mean, I think building capacity to be equitable partners is really important in any partnership, but that extends beyond those who are involved in committees or advisory committees. It also extends to those in the community who are sick of being studied or sick of the surveys with the gift cards. And the Promise Zone was not a grant, but came with priority points on federal grants. So it dramatically increased the amount of research that was happening in these neighborhoods, where folks were getting, preliminary studies for their NIH grants or other grants. And so folks were getting very upset about the research happening. And so I've been supporting for the last 10 years the development of a community research review board, which is trying to bring the power back into the community to be able to review what researchers are proposing to occur in their community, and to make sure that they're providing job opportunities, that they're reporting results back, that they have a community engagement plan, that they're representing community priorities around research questions and the like. And so I was actually able to get a local foundation funded grant to be able to build the organizational infrastructure of that group, to be able to get their 501c3 status, to be able to apply for grants, and to be able to build donor relationships and things like that. Because I don't think we invest enough in community infrastructure for research, let alone community-based organization infrastructure to evaluate their own programs, since they are more focused on the interventions and less on the research, as I think Jamie mentioned. And I think are making sure that they're serving their community. So research is often something that's either seen as something done to them, or maybe not as useful as it could be. So at Drexel, we're working at ways that we can be more community engaged in the ways that our IRB reviews studies to happen in these neighborhoods as well. So I think it takes pushing at the institutional level as well.
Okay. Okay, thank you very much. The other question comes from the audience. And it says the West Philadelphia area, this area has gone through substantial change over the past 10 to 20 years, in part because of investments made by UPenn, which may be more visible than those made by Drexel, since we're very close neighbors there.
Mm-hmm.
So there's been turnover in the neighborhood in terms of who lives there and so forth. And I would love for you to spend just the 1 minute we have left explaining that, and and what the academic environment has, the effect it's had on this particular neighborhood.
Yeah, I mean, if you ask anyone in the neighborhood, they will say that academic institutions did their research in the 60s, and then they came around and took their properties, right? So there is both that historical trauma, and then there's the very real experience of both, private developers taking advantage of a lot of vacant land because, a lot of old housing stock and raised buildings, and then also academic institutions growing their campuses, and in particular their, sort of medical and health related campuses, which is why we say that there's such an important need for community workforce for research and, health programming and health jobs. And so, I think what you see too is a generational divide. There are those who remember, what the neighborhood was like in the 60s, and there were those who might be more recent transplants. And so any of the work happening at the community level really requires an intergenerational sort of recruitment and engagement process. That has been a challenge for some of the community development corporations and neighborhood civic associations I work really closely with. Sometimes it's sort of the elders in the community are trying to kind of, protect the community's interest and, really challenge to bring these younger voices in. And so I think, youth leadership development programs and career development programs, some of which we did provide through Promise Neighborhood. We had a community power academy that we intentionally, held slots for youth. And including, sort of youth-led credible messenger and community health worker programs. We have a lot of gun violence prevention programs in those areas, but making sure that it's not just, workforce, but it's also engagement and, civic engagement and community power and in community-based organization infrastructure. So, I think it's all communities are constantly shifting in their demographics, and I think investment in those organizations and those systems to continually be able to understand those shifts and to be able to, leverage all of the natural talent and human capital that exists within their community is very important.
Thank you. And thanks for bringing this work forward into this national forum. And I'll now turn it back over to Dan.